The following presentation is a patient case example for Complex Scenarios 8640. Before I begin the case, I just want to give a brief warning that the following case contains descriptions of religious and sexual trauma. I will try to timestamp the location in the video so that it can be skipped if needed. The case. A 25-year-old patient named Sarah is referred to pelvic floor physical therapy for pelvic floor dysfunction. She was referred by her gynecologist because she was unable to perform a standard pelvic exam and pap smear. During the subjective portion of our physical therapy evaluation, Sarah mentioned she has had difficulty inserting a tampon, and it recently has felt like her partner is hitting a wall when they attempt to have penetrative intercourse. It also feels like a burning or stinging sensation with these attempts. Based on the textbook description of her symptoms, I suspect vaginismus. I would like to conduct an internal exam and use the perfect score to assess pelvic floor strength, endurance, and control. After explaining the logistics of the internal exam and obtaining consent from the patient, we begin to move forward with the exam. However, I notice as I begin to examine her perineum externally that her adductors tense up and her breathing quickens. I try to meet her gaze, but her eyes are glazed over and she appears to dissociate. It takes me a couple tries repeating her name before she finally responds. Recognizing these are potentially signs of retriggering trauma, rather than continue the exam, I stop and say that I think I've gathered enough information for today. I let her know that she can get dressed and we will talk about my findings in a few minutes. I give her privacy to get dressed, and when I return, her eyes are puffy, her cheeks are red, and it is evident that she has been crying. I ask if she is okay and if there's anything she would like to talk about. I provide a non-judgmental, safe space where she shares that she had a very religious upbringing and she feels like maybe this is God's way of punishing her for having premarital sex. She says that this is not her first sexual partner, but that her last guy did some very unchristian-like things that she would rather not get into. I ask her if she had talked to anyone else about this, and she says that she had recently confided in a friend who recommended their counselor/therapist. However, they were out of her insurance network and she was not able to go. I asked if she would be interested in being connected to free counseling services in the area, and she says that she would be grateful. I refer her to a trauma-informed provider from the RAIN website, and we end the session with diaphragmatic breathing as a grounding technique. In future sessions, we focus on pelvic floor relaxation exercises, including child's pose and happy baby, as well as nervous system downregulation in the form of diaphragmatic breathing to treat her vaginismus. This case is a textbook example of vaginismus presentation and treatment. I was able to combine scientific literature from Laycock and Jerwood with the expert recommendations from Dr. Sarah Reardon and community resources from RAIN to help this hypothetical patient get the care she deserves.